That's right. Okay. Hello and welcome to this week's program of the Rotary eClub of Silicon Valley. Each week we connect with and hear from fascinating and inspirational speakers, often with a message focused on our interests in innovation, entrepreneurship, and education. As a Rotary Club, we look for ways that these programs might foster new approaches to improving communities near and far. We're glad you joined us and hope you will enjoy how we are exploring how technology can serve the business of service to others. This week, we will get an overview of the current status of global polio eradication efforts and highlight the role that every Rotarian plays in this historic effort, covering the disease itself and its devastating effects, the progress that has been made, and what still needs to be done to achieve a polio-free world. Our speaker is Carol Pandak, the director of Rotary International's PolioPlus program. For 25 years, Carol has worked for national and international nonprofit organizations, including Rotary International and the American Academy of Pediatrics. Carol directs all aspects of Rotary's polio eradication activities, including administration, advocacy, grants management, financial oversight, fundraising support, and volunteer engagement. She supports Rotary International's PolioPlus committee, the volunteer committee that provides strategic guidance to the PolioPlus program. She also works closely with the partners in the Global Polio Eradication Initiative, including the WHO, World Health Organization, UNICEF, U.S. Centers for Disease Control and Prevention, and the Bill and Melinda Gates Foundation, and serves on multiple cross-agency committees and management groups of the Global Polio Eradication Initiative. Without further ado, I'd like to present Carol Pandak.
Thank you very much, and glad to be here today. And what I'd like to do is show you a PowerPoint presentation, a brief presentation on the status of polio eradication today. So I will get started now. So this will be a brief update on the global status of polio eradication, what still needs to be done, and the role of every Rotarian in this global effort. It's not moving. Okay. Okay. The current, I'm sorry, I'll provide an update on the current status of polio, talk about the End Polio Now Countdown to History campaign, and talk about the role of every Rotarian in the global effort to eradicate polio. So many of you already know what polio is. It is a devastating disease that can cripple a child for life. There is no cure for polio, but it is completely preventable with the vaccine. So this is just a reminder of why we're doing what we're doing. The picture, the black and white picture, is from the 1950s, the polio epidemics in the United States, where there were some 50 to 60,000 cases of polio every year. And the other photos is really the face of polio today. Polio is paralyzing the world's most vulnerable children in places that have the fewest resources to help them should they contract polio. We work very closely with our partners in the Global Polio Eradication Initiative. That includes the World Health Organization, UNICEF, the U.S. Centers for Disease Control and Prevention, and more recently, the Bill and Melinda Gates Foundation. But equally important are the governments of the world. Not only the donor governments that provide funding in addition to Rotary and the Bill and Melinda Gates Foundation, but also the governments of the polio-affected and high-risk countries, because their engagement is important to ensure that polio remains a priority on their health agendas. Now, when the Global Polio Eradication Initiative was launched in 1988, there were some 350,000 cases of polio every year. That's 1,000 children a day being paralyzed by polio in 125 countries. In 2018, only 3 countries have never stopped the transmission of the wild polio virus: Afghanistan, Nigeria, and Pakistan. And to date, this year, there's only 3 cases reported in Afghanistan, but we do have some advanced notification of 2 cases in Afghanistan, so we're 2 additional cases So we'll have to keep our eye on that next week. I think this chart really shows the extraordinary progress that we've made over the past 5 years. Some people say, you know, when are we making progress? When will we eradicate polio? And I think this shows that even from 2013 to 2018, the decline in the number of polio cases is indicative of the progress that we're making. So what still needs to be done if we only have 3 or maybe 5 cases of polio in Afghanistan? Well, as long as the polio virus circulates anywhere in the world, all children are at risk. Polio, as they say, is only a plane ride away. So even with only 3 or 5 cases of polio so far this year, we need to continue to immunize every year for the next few years up to 450 million children against polio. And that requires hundreds of thousands of frontline healthcare workers going door to door, making sure that every child is reached with the polio vaccine. And now that we have so few cases, we have to make sure that there is no virus circulating. So we're not only doing disease surveillance, meaning looking for children who have possible symptoms of polio, but we're also testing sewage now and expanding those testing sites over multiple countries, because the polio virus can live outside of the human body for up to 2 months. So with so few cases, we need to make sure it's not living somewhere in the environment as well. And this is an important point, because for the world to be certified polio-free, we need to go 3 years with no polio cases, either in people or the environment. So being able to find it in the environment is critically important as we reach the end game of polio eradication. And I think another example or an indication of how close we are to ending polio is our planning for a polio-free world. After the world is certified polio-free, there are some activities that will have to continue for a while, like disease surveillance to make sure there isn't polio lurking somewhere in the world. And these activities will need to be maintained and mainstreamed into current health systems. And we'll be sharing the knowledge and lessons learned over 30 years of polio eradication. And Rotary has amassed many lessons around our effort to eradicate polio, partnering with other organizations, the role of a grassroots service organization. So all of these lessons need to be shared to benefit other health programs or development programs all around the world. And then the transition of the polio assets and capacities. Through polio eradication, we have developed an extraordinary infrastructure to be able to deliver the polio vaccine to billions of children. And that infrastructure can help other health priorities. And so there's a program of work that's looking at how to transfer those polio assets after the eradication of polio. So this is where Rotary and Rotarians come in. In Atlanta, at the Atlanta Convention, we launched the extension of our agreement with the Gates Foundation under the title, the End Polio Now Countdown to History fundraising campaign. And this is a continuation, as I said, of our relationship with the Bill and Melinda Gates Foundation, whereby every dollar that Rotary commits to polio eradication, up to $50 million a year, will be matched 2 to 1 by the Gates Foundation. So that means if Rotary spends $50 million in a year, the Gates Foundation will match it with $100 million. And I can say that I think it was January 17th of this year, we did receive $100 million because Rotary had committed $50 million in October of 2017. And all clubs, eClubs included, are being asked to contribute at least $1,500 to PolioPlus for the End Polio Now Countdown to History campaign. And the districts are being asked to contribute 20% of their district designated funds. This is a question that I get a lot, and you may wonder as well, is where does the money go? What is it spent on? So most of the funds that Rotary raises through the End Polio Now campaign goes to the World Health Organization and UNICEF, who are considered the implementing partners of the Global Polio Eradication Initiative. And it's primarily for the operational costs, that is, whatever it takes to get the polio vaccine into the mouth of a child. And what is that? That could be transportation for vaccinators to get out to the field. It is the cold boxes that are used to keep the vaccine cool because it needs to be kept at a cold temperature. It is the finger markers that are used to paint a child's pinky purple to indicate that they've been vaccinated. It's the chalk that marks the house to indicate that vaccinators have been to a house. And it's the hundreds of thousands of vaccinators, the frontline health workers that are out there immunizing all of these children. We also spend some funding on social mobilization, which is the awareness raising activities to alert parents that polio immunization activities are taking place, but also to talk about the benefits of immunization and create demand for immunization in communities. And that's followed by technical assistance, and that is the technical expertise, the doctors, the medical professionals that are hired at the national or international level in order to help implement the polio eradication program. And I think some people would be surprised to know that we spend very little on vaccine because there are many other donors in the global health community that are willing to pay for the vaccine. So your role, and really the role of every Rotarian, is to learn as much as you can about the history of Rotary's role in polio eradication. We are considered the organization that first had the vision of a polio-free world. Share what you learn with your fellow Rotarians, your neighbors, your local media. We want to get the story out about Rotary's historic effort to eradicate polio, and then ask those friends and consider for yourself a donation to PolioPlus so that everyone can participate in this historic effort to end only the second human disease in history. A good opportunity to be sharing all of this information and generating excitement is World Polio Day. It's on October 24th, 2018. Rotary has a live stream event on the endpolio.org website. And our theme last year was World Polio Day is everywhere. And we encourage Rotary clubs, eClubs included, to register their End Polio Now World Polio Day events on Rotary's website. And we had over 3,500 clubs register events. So it was really exciting, and we're looking to have even more events around World Polio Day. So that concludes my formal remarks, and I'd be happy to answer any questions that you have. And again, thanks for inviting me to make this presentation.
Awesome. Cecilia, your mic is not on.
My mic is not on.
Cecilia's.
My mic was not on. Okay.
Oh.
So anyway, thank you for your presentation. I think it was concise, and yet I think gave the information that most Rotarians certainly want to know at this point, and that's the bulk of our audience will be Rotarians. I wanted to say that before I go into my first question, that in our district, we do our annual fund campaign for unrestricted giving during the first half of the Rotary year, and our PolioPlus campaign in the second half. But somehow we've gotten people really motivated, and already we have raised over $200,000 for
oh my goodness
this year in our district, and so we're pretty proud of that. But anyway, and we have one of our club members who contributes just about $1,000 a year to polio. He's very committed to it. He's a judge, so he couldn't attend today's session. I'm sure he'll watch it though afterward. So you were very helpful to me in preparing a presentation that I made to the American Microbiology Association here a few weeks ago, and one of the resources that you pointed me to was the Global Polio Eradication Initiative website. And I think that's gpei.org, right?
I think that's polioeradication.org.
Oh, okay, right. So I wanted to make sure that we made people aware of that so that Rotarians themselves can go see it, because it keeps totally up to date about the statistics at any given time.
Yeah, it's a terrific resource. I think the two best resources from a Rotary perspective is npolio.org, and then from a technical perspective, polioeradication.org. It's updated every week. They have fantastic stories. They have a great story up about a female vaccinator in Pakistan. She's amazing. Show her going out on her motorcycle out into the field. So it's a really great place, not only to get information, but really great stories about where we are and the people that are on the front lines of polio eradication.
That's great. And so how many children are we immunizing each year now? And I realize we're immunizing in many more than the 3 countries that are endemic.
Yeah. Right. So we're immunizing up to 450 million children every year. Wow. In up to 60 countries that are supported by the Global Polio Eradication Initiative, because as long as polio exists anywhere in the world, all children need to be protected. And so we're looking for every last child, whether they're living in the slums of Karachi or whether they're in a country that maybe hasn't had polio for a couple of years. All those children need to be protected.
Right. And so that immunization effort, I think, is going on in countries that surround the endemic countries, especially, or countries that are resistant but not yet resilient, right?
Yeah, so there are countries there that are considered high risk. There's medium risk. There's some low risk countries. But if you think about Nigeria being one of the highest risk countries, still endemic, there's lots of activities that's happening in the countries that are surrounding Nigeria. Of course, even India, that was declared polio free many years ago, continues to immunize their children because their proximity to Pakistan and the amount of travel between Afghanistan and India. So it's interesting, you have to look at the kind of migratory patterns of people too, like where are they going? Where do they tend to go? Because maybe they're from a country that's low risk, but they tend to travel to high risk countries.
Right. Including, they could come here where we have low risk.
We have low risk, right? But there are communities in the United States that are somewhat resistant to vaccination, have opted out of vaccination. And so while probably we're low risk because we have pretty high immunization levels, it could happen. It happened that somebody traveled from Pakistan to Australia and he had polio. Well, he didn't cause an outbreak because they have high immunization rates. It does show that people travel and can come down with polio while they're in another country. Right.
So Mitty, do you have any questions?
Yeah, Carol, earlier in your presentation, you actually mentioned that right now Afghanistan also recently saw a couple cases. I think you mentioned 2. I know on the Polio Now website, it indicates 3, but has 3 different dates and it looked like different years as well. I was wondering, can you maybe talk a little bit about what does that look like in terms of how these cases are reported? Are they reported at hospitals, and does that information go to the World Health Organization, or how do you kind of figure out that kind of system in place? And then also maybe talk a little bit about what are kind of the next steps in terms of monitoring these cases that you guys are looking at right now.
That's right. So the official count that you see on the polioeradication.org website is 3. But we have advanced notification of 2 cases, one in Kunar province, one in Kandahar. It's the disease surveillance system that is picking up these cases. So you have these, maybe somebody goes to a hospital, but perhaps more likely is that there's somebody in the community that's been trained to identify the symptoms of polio, which is essentially a weakened limb or a floppy limb. And then that person, like an informer, will advise the local health worker, who then, it kind of goes up a chain, and then it gets to the World Health Organization and the national government in Afghanistan, and they immediately go and investigate the case. And they'll send a team to investigate, find the child, try to determine if it is polio, take 2 stool specimens, and then also look around to other children in the area and take some specimens from them as well to see if maybe if it has spread. So there's a whole system in place. It's very routinized that happens when you identify a case of polio, and then that gets reported up through the region and then immediately to the World Health Organization. So you have this period of time where you have advance notification and there's work going on, and then you need to determine through the stool samples and testing whether or not it's actually polio. So it may take a week or two to get onto the official count.
So the advance notifications that you've received are not yet confirmed. Is that what you're saying?
Yeah, not yet confirmed, but probably likely. And what will happen is, depending on the investigation, it will determine what kind of a response we'll do. Whether you likely do an immediate response in the immediate area, and then maybe do a larger response after a couple of weeks, where you can get your kind of act together to do a much larger response to try to stop the transmission as quickly as possible.
Right.
Okay. And are there specific regions that these two advanced cases are centralized in, or is it just really kind of random based off these two, but also the past few cases in the past 3 years?
Yeah, these are, there are known what we call corridors of transmission and high-risk geographies in the remaining polio endemic countries. Because even if you take Nigeria or Pakistan or Afghanistan, it's not that the whole country is covered with polio or has experienced polio. There are these pockets that are particularly difficult because maybe they have nomadic populations. There's conflict in the area. The shared border between Pakistan and Afghanistan has a tremendous amount of movement between the two countries. So we know where these pockets are, and that's where these cases tend to come from.
Perfect. Thank you for explaining that.
Yes. Any other questions, Mitty?
Carol, how long have you been working on the PolioPlus program?
That's a great question. I have been the director of the program since 2000.
Okay. That's a good amount of time. And how did you get involved with the program 18 years ago then?
Yeah, it's interesting. I worked for Rotary, and then I got recruited to the American Academy of Pediatrics after I got my doctorate. And I was leading their program, their Community Access to Child Health program that worked with bringing health to children that didn't have access in the United States, and then got recruited back to Rotary 3 years later to be the director of the polio program. So kind of an interesting career path.
Wonderful. Well, thank you for all the service that you're doing to not just Rotary, but also to the world.
Well, thank you. It's been great, and it's extraordinary because we are so close to eradicating polio. And from 2000 till now, I've seen the extraordinary progress that's been made, and the amount of time and effort that Rotarians and our partners are putting into this effort. And it will be an extraordinary event when we succeed in the next few years.
Yeah, absolutely. I think, so I'm on the endpolio.org website, but just looking at this, the block that says current status, and you see like Pakistan is 0, Nigeria is 0, and you see Afghanistan 3. It's like, that's so exciting compared to even just like 3 or 4 years ago when you could, you could tell people the acronym PAIN and then the acronym PAN. And then now you're at this point where it's like, it's P, or it's like, it's A right now, and then like maybe we'll get 1 or 2 cases, hopefully not.
Yeah, it's a good point. Yeah, you're well informed.
So I wanted to speak just quickly to the infrastructure, and you alluded to it in your slides, that has been created as a result of the PolioPlus campaign. We had a program called Partners in Service several years ago where we brought in Rotarians from around the world to talk about Rotary in their area. and they visited all of our clubs. We'd have 6 a year. They'd visit all of our clubs and talk to the clubs, telling them what was going on. And we had a gentleman from Nigeria who talked about what happened when Ebola broke out in Nigeria. And I'm sure you're familiar with this. They used the polio, the infrastructure that had been created for polio to get the word out about the proper behaviors, and they stamped the Ebola problem out at 60 cases, which was just unheard of because, of course, it was raging in Sierra Leone and other places. And so I think that's something that we should be really proud of.
Yeah, and that's interesting because it's in Nigeria, Pakistan, and Afghanistan, we've established what are called emergency operation centers. So at the national level in the capital, and then in the provinces or in the most high-risk states. And that is based on the emergency operation center model that is at the U.S. Centers for Disease Control and Prevention, which polio right now is one of the diseases that is in the emergency operation center, but it's a command and control type of setup where, you know, everything's pretty regimented and you can do things faster because you're in emergency mode. But it's kind of cool to see that that's been replicated very successfully. You know, in Nigeria is the great example about how they got rid of polio or stamped it out as quickly as they did. Yeah.
Yeah. Oh, Mitty, anything else from you?
That's it for me. I really appreciate your time, Carol. It's been wonderful hearing about the update from you, and thank you for answering all these questions.
Sure, thank you. Thanks for having me.
Okay, well, we would like to encourage all of those who have enjoyed this program to let us know what you think. Below, you'll find our Discuss tool for sharing and responding to comments. Please take a moment to add to the conversation. Members and Rotarian guests, make sure you fill out the attendance section too. It helps us know about the reach of our efforts and also serves as a makeup for a missed meeting. If you put your email address properly below, you will get a message you can pass on to your club secretary. As always, we give our final word to our speaker. Carol, take it away.
Well, thank you. It's been an honor to be with you on this over the computer for this eClub presentation. It's my first one. Well done, Cecilia and Mitty. And I'm so excited about where we are in the effort to eradicate polio, and so just honored to be working with Rotarians all over the world. We are so close to eradicating polio, and Rotary, as the organization that first had the vision, has kept this thing going to the end. And so I want to thank everyone for their extraordinary commitment and support on behalf of the children everywhere. Thanks.
Thank you so much.
Thank you.
Oh, okay.
You just go ahead, stop record.